Hi, my name is Katrina Bird. I'm currently an adult and pediatric infectious disease fellow at Brown University Lifespan. So what does that mean? Basically, it means that I've completed my training in internal medicine and pediatrics, and I'm doing specialized training in infectious diseases. Coronavirus is an infection that pretty much causes a common cold. So there are multiple viruses that cause a common cold, like adenovirus, rhinovirus, and coronavirus happens to be one of them. Unfortunately, the COVID-19 or coronavirus 2019 really is devastating because it's mutated and it's causing infection in a lot of people. So we think it spread person to person through infected droplets. So what does that mean? If someone coughs or sneezes on you, or they have coughed or sneezed on their hand and then they touched different surfaces and you come back and touch that surface, we think that's how this virus is spreading. A lot of people ask, how do I know if I have COVID-19 versus a regular cold? So it's a little bit tricky, but the primary symptoms that people often experience are fever and problems breathing, whether it's cough, shortness of breath, problems breathing with walking or doing your normal everyday activities. Those are the two symptoms together. Fever and problems breathing are the primary symptoms that patients experience. So if you're overall concerned about your health, you definitely should call your doctor and come in. But specifically, when should you be concerned that, oh, could I possibly have COVID-19? So if you have traveled to a place within the last 2 to 3 weeks to a place that has high rates of COVID-19, so Italy, China, there are multiple other countries, then you are most likely at risk. That's number one. Number two, unfortunately here in Rhode Island, we've had a few cases. So if the Department of Health has contacted you and told you that you are one of your close contacts had this infection, then you're at risk. But in general, if you're not having fever with the problems breathing and you haven't had a close exposure, most likely you don't have COVID-19. A lot of times if you're having runny nose, stuffy nose, headaches, those are symptoms that sometimes are associated with it, but if you're primarily having those symptoms, I would be less worried about that. The number one thing you should do is wash your hands. So as I just stated, the way it's being transmitted is if someone with infection coughs on their hand and then touches something and then someone comes back behind them and touch that whether it's a doorknob or a railing. So really being proactive in regards to washing your hands and or using hand sanitizer is going to be key. The other thing is you have to try to avoid touching your face, picking your eyes, your nose, your mouth, because if you were to get the infection on your hands, you would transmit it to yourself by touching your eyes, your nose, and your mouth. So you want to not only wash your hands or use hand sanitizer, but try to avoid touching your face and your mouth. So you want to make sure that you are applying soap, so that's important, not just rinsing your hands with water. You want to make sure you're applying soap. And in general, I say sing happy birthday to yourself. If you're taking the time and singing the full song, then you've washed your hands long enough. In regards to hand sanitizer, you want to squirt about a nickel size amount in your hand and make sure you're working it on all surfaces of your hand. And you want to do that and really work it in for about 30 seconds. You're physically getting the dirt and virus and bacteria off your hands, and that's the most important thing. we just want you to wash your hands. So I don't care if it's hot, cold, lukewarm. The most important thing is you're washing your hands. So this is actually cold and flu season. The one outside of COVID-19, influenza still is really problematic in this country. Millions of people are infected with influenza, and about 30,000 people per year die from influenza every single year, and I'm only talking about in the United States. So tens of millions of people get infected, about 30,000 people die from influenza in the United States. So doing these preventive measures, washing your hands using hand sanitizer, avoid touching your face and mouth, as well as getting your influenza vaccine are all going to be important during this time. Let's say you are really concerned that you might be infected. Maybe you have a lot of anxiety about possibly being infected with COVID-19. That's 100% totally understandable. So what should you do? The first call you should make is to your primary care doctor, if you have one. What's happening around the state is primary care doctors have a protocol, so they'll listen to your complaints, and based on the answers to the questions that they ask you, they'll determine if you have a high risk of having the infection or not. I urge you to call your primary care doctor and not just show up to the clinic. This is going to be important because there are some steps you need to make, such as wearing a mask before walking into the building, or even the waiting room to your primary care doctor. However, you're probably asking, what if I'm too sick? Like, I just feel like I need to go to the hospital. Fine. Please, if you have to call the rescue or EMS, please let them know that you are concerned that you may have COVID-19. In that case, the EMS workers and additional staff can use the proper protection to protect themselves and make sure to protect you and to protect yourselves, and make sure we're limiting the spread of infection. When you think about travel, if it's something that's absolutely required, it's something that was pre-planned and you absolutely have to go, by all means go. But you really should be cautious and make sure you're diligent in washing your hands, avoid touching your face, so forth and so on. However, if this is a vacation, I would do my best to try to reschedule, because why knowingly put yourself at risk?